It's well known that there are many social determinants of health that contribute to our health outcomes. Of those determinants, there are many barriers, including those based on age, gender, social and economic status, race, and geographical location. People living in rural areas of Canada are no stranger to these barriers, and something needs to be done to make our healthcare system more accessible. The answer? Telemedicine. Looking at this chart, you can see that 21% of Canadians live in dispersed geographical locations known as rural areas. The remaining 79% of Canada's population lives in compact urban regions of Canada. Given the population distribution, it would be expected that our health resources be evenly distributed, but that is not the case. As you can see, although 21% of residents live in rural areas, only 9.4% of physicians and an alarming 3% of specialists are located in these regions. Our country is suffering from a geographic maldistribution of human resources for health. Why? Primary care providers, or PCPs, and more specifically specialist doctors, tend to cluster in highly populated urban centers. This can be due to a variety of factors, including job availability, access to more patients for research purposes, access to amenities, need to satisfy spousal employment objectives, and to avoid isolation from peers. Accessibility is one of the biggest barriers for people living in rural communities. People living in these areas have a low availability of healthcare resources. On top of this, those living in rural regions tend to have a lower income and a higher unemployment rate due to more seasonal industries, further creating a financial barrier. The Canada Health Act states that the primary objective of the healthcare policy is to facilitate reasonable access to health services without financial or other barriers. The current healthcare options set in place do not meet the standards set by our government. Further to the aforementioned financial barriers, those seeking medical treatment in these areas currently have to travel long distances to seek care. These long distances result in high travel costs and missed work. As many people in these areas are struggling financially, they are unable to make these sacrifices for their health. Finally, because of the shortage of medical care, people in rural areas have significantly worse health outcomes. Some of these health problems include higher rates of long-term disability and chronic illness, higher rates of obesity, heart disease, diabetes, respiratory and infectious diseases, among other things. Tragically, Inuit youth living in rural areas experience the highest suicide rates in Canada. From all of this, those living in rural areas also experience lower life expectancies and a higher infant mortality rate. These problems are clear and need immediate attention. Luckily, there's a possible solution to our limited access to specialists and PCP problem. This can be found through virtual access to care, also known as telemedicine. Telemedicine essentially means to heal at a distance and involves the use of information and communications technologies, also known as ICTs, to increase access to care and information. I am proposing that our Canadian healthcare system migrates to using telemedicine for patients located in rural regions that currently have barriers to accessing specialists and PCPs. I'm recommending that Canada take the approach of real-time doctor-to-patient and or doctor-to-doctor exchange of information through video conferencing to maintain patient engagement and the same quality of care that patients receive in a real face-to-face setting. The UK started to investigate the use of telemedicine in 1991 and has found the transition to be successful. One of the strategies that I'd like to see our healthcare system adopt is using a two-way interactive television or video call system in lieu of a typical face-to-face in-person consultation. For regions with PCPs but no specialists, my strategy will see patients going to their PCP to get a referral to a specialist, and then use a video call system either in the PCP's office or if at-home internet access is available, they can see a specialist from home. For areas without PCPs or specialists, I foresee using the strategy to access both. My plan proposes using town community centers for those without internet access to set up a video call system to access PCP and specialist resources. The adoption of these strategies will not only directly benefit the patient in cost and travel time reductions, but will improve access to expertise that they would not be able to find in the remote rural community. As any specialist will be able to use telemedicine, these strategies will reduce long wait list times, typically experienced to see a specialist in your area, and result in a gain of productivity. The resulting implementation of telemedicine for rural areas of Canada will greatly improve the performance of the Canadian healthcare system. Telemedicine helps break down barriers by creating more convenient and accessible patient care. Our current rural healthcare system does not meet the previously mentioned demands of the Canada Health Act, but this new system will. On top of this, telemedicine will help lower individual patient costs associated with traveling far distances to see PCPs or specialists, as well as reduce missed work time. Furthermore, from the study of telemedicine versus traditional care in Australia, it was determined that this strategy will result in net savings for the government on healthcare. Finally, the use of telemedicine will result in better health outcomes for those living in rural areas and lessen the health disparities between urban and rural communities. It has been found that those accessing telemedicine had seen noticeable improvements in health outcomes, improved qualities of life, and even reductions in mortality rates. It is very clear that the demand for healthcare services in rural regions is high, but we as a country currently don't have the resources to make rural healthcare accessibility the same as it is in urban centers. Although we cannot physically build endless amounts of hospitals and stock them with specialists so that rural residents can have equal access to their urban counterparts, we can implement telemedicine in these parts of the country to provide long overdue access to PCPs and specialists. The use of this strategy will greatly improve the performance of the Canadian healthcare system through universally accessible patient care, greater cost effectiveness, and by improving health outcomes of patients using the service. Our current healthcare system is violating the Canada Health Act by not providing reasonable access to healthcare services without financial or other barriers, and immediate changes must be made by the Government of Canada. Thank you.